Hi, my name is Jaclyn Smith. I'm a certified nurse midwife.
And my name is Giambalva, and I am the Director of Nurse Midwifery Services here at the Valley Hospital, Valley Health System. So we have a couple questions that have come in from the community about, what midwives do, how we operate. I think the first question that we have here is, what is a midwife, Jackie, and what inspired you to become one?
So a midwife is a healthcare provider that cares for women throughout their lifespan, from teenage years up until adolescence, throughout pregnancy, childbirth, and also through the later years of life, menopause, premenopause. So we really care for women throughout their entire lifespan.
Of all ages.
Yeah.
Is there anything in particular that inspired you to become a midwife?
Besides you, as a nurse, I witnessed midwives in the way that they treated their patients and the bond that's created when you deliver a baby and get to care for the women all throughout their postpartum period.
I was a nurse practitioner first, and I kind of wanted to do a little bit more and deliver their babies, and I really just felt like that was a great way to do it. And you follow in the footsteps of the people who teach you, right?
Yep.
So that's how I felt. I ended up becoming one. All right, let's look at the next question.
So the next question is, why choose a midwife for your pre- and postnatal care?
People have different desires during the course of their pregnancy and their labor and their delivery. I think that there are patients who are looking for maybe a more natural type experience, and that's sort of where midwives excel.
We use medicine if needed, but we also try to use some holistic modalities also to kind of get the woman as comfortable as she can be during her labor and delivery process.
For sure. What are 3 tips you would give a newly pregnant patient for staying healthy throughout a pregnancy? Great question.
During your pregnancy, we would just say maintain a healthy diet, healthy water intake, exercise, and the big thing is stress management, being able to just not overthink your pregnancy and really just, having support around you.
If we could get, half of our patients to just take a big deep breath and know that the system really works.
Yep.
Don't you feel? I feel like that
100%.
would, 100%. That would kind of, let people enjoy their pregnancy as opposed to having it be a time that they're afraid of and they can't wait till the baby gets out because that's when things are going to be okay. When truthfully, the journey begins once the baby comes out, right? It's the safest when it's inside. Yeah, for sure. Okay.
What would you tell a first-time mom-to-be about being pregnant during a pandemic?
Being pregnant during a pandemic is not that much different than being pregnant outside of a pandemic. For the mom, obviously it is, because there needs to be really good hygiene. But I would say that to anybody. We need to be really good about washing our hands and maintaining, safe distance from other people and wearing your mask. Those are guidelines that are here for everyone right now. As far as the baby, because women come in very nervous about this. I'm pregnant during a pandemic. What do I do? But again, the baby is never safer than when it's inside your uterus. So really, it's more, how do I keep myself safe? Okay, do you work as a team during labor? And how do you work alongside physicians and hospital RNs during a delivery?
So the teamwork is absolutely the most important thing. Chris and I know when we need to get a physician involved if things start becoming high risk, or for example, if a patient does need to go for a C-section. Chris and I are both first assistants on C-sections, so we can really stay with you throughout that delivery as well, and either assist at the surgery or even be there for support. Keeping it still holistic, right? There can be soft music playing. You can see the baby right after the delivery. Sometimes we can even go skin to skin right after the delivery in the operating room. But the nurses are really an important part of that team as well.
The nurses at Valley are, again, some of the best that I think I've ever worked with, and so supportive of a natural childbirth experience for those women that are looking for that.
Yeah. I wanted to say really quickly also, because a lot of times when you think of a midwife, you don't think of anesthesia or an epidural. The anesthesia department is amazing at working with our patients at any stage in labor, getting an epidural into them and making them very comfortable.
I think sometimes people think that midwife patients have to do it naturally all the time, right?
Exactly.
If at the end of the day, you have a healthy mom and a healthy baby and a mom that says, oh my God, that was the best experience. Then we feel like we've delivered, we've done our job. And sometimes it takes an entire team of people to get that patient there. But if that woman feels empowered at the end of the day, then no matter how the baby got here, it was a great experience for her.
It's like the saying, it takes a village, right?
Takes a village.
Yep. So, Chris, what is the difference between a midwife and a doula? Because that's a common question we get.
Doulas are a huge part of the collaborative team that works, helping to get a woman from pregnancy through labor and to delivery, but they don't have specific medical training. So they are trained in that gentle art of labor support and strictly labor support for the patient. They can sort of render their opinions and maybe pull from past experiences in other patients that they've been with, but they don't have the training to provide medical care. And that's the big difference between what a doula does and what a midwife does, which is essentially makes the medical decisions. Midwives diagnose, we do the delivery, we're there with the patients in labor, we see gynecologic patients, we write prescriptions.
And getting back to like that previous question, it said it's all part of the team, right? So you have the midwife, you have a physician, you have the nurses, and you have a doula, and then anesthesia if we need it.
Yeah, I think the team approach, Jackie and I have found that the team approach, getting
best.
patients, from day one to holding their baby after it's born, the more people that are involved that are there to support that woman in that process, it's all a huge success at the end of the day.
And we're here to support and empower women. That is our main goal.
If you have additional questions or other issues that you'd like to discuss with one of us, it's Jackie or I. We are happy to answer those questions for you. We see consults with patients all the time that are maybe not sure if they want to go the midwife route, but if you have additional questions or you want to sit down and talk to us, you can go to the Valley website, which is valleyhealth.com, and you can schedule an appointment with either one of us or chat with us at your leisure. Thanks so much, guys.
Bye.